35 that ever fly with a flight physician on any of their flight missions, and there are 7, at my last count, that, like us, fly with a flight physician on every flight. So we're quite unique in the United States. We feel strongly that on the physician side, an emergency medicine physician is ideally suited to do this job well, because emergency physicians are trained to deal with the emergent care of any kind of patients.
Much of what we do here, probably the most important thing we do here is not necessarily getting the patient in the helicopter and going. It is getting the doctor and the nurse to the patient initially. You are really you're in effect bringing an emergency room to that patient, and that is what we really do. Once the doctor and nurse get there, things tend to get stabilized, they get calmed down, they get the basic necessities they need, and then we get on our way. And that has made it tends to make a much greater difference getting them to the patient as opposed to the patient to the hospital.
One of the biggest advantages to being at a hospital-based flight program like we are is that our crew, when they're not out on a flight, has the chance to take advantage of all of the educational resources of the hospital. In either the flight physician or the flight nurse case, it's a several-month process to really finish your orientation and be ready to fly as a full-fledged member of the team. A large part of that is in doing what we call the buddy flights or ride-along flights, where you are not the crew member primarily responsible for caring for the patient, but you are observing more experienced crew who have been doing the job for a while, taking care of the patient, while you are watching and learning from them, you are getting to the point where things like aviation things like how to work the seat belts, how to fasten your helmet becomes second nature, so that you don't have to think about those things at all once it becomes time for you to be a full-fledged flight crew member. We have flown with a flight doc, an emergency physician, since our very first day back in November of 1984, and there's basically 2 reasons that we do it. Most importantly, by far, is that it is, we believe extremely strongly, what is best for the patients. The second reason being that it is an incredible educational experience for the flight physician.
University of Cincinnati Emergency Medicine Residency Program is the oldest emergency medicine residency training program in the country. We began back in, I believe it's 1978, for the very first training program. And so we attract a lot of the most competitive, the best resident candidates out of medical school who want to come here and do their residency here. And so it's a match program where we're trying to attract them and recruit them, and on the same time they are looking at the best programs to go to do their training. Fortunately, we fall into one of the best programs, training programs in the country, and we attract some of the highest caliber students to do that.
I was drawn to UC because it's one of the best residency programs in the country. They recruit medical school applicants from all over the country. We have people from the East Coast to the West Coast, Texas, Canada, and that kind of quality of program really attracted me.
So the University of Cincinnati Emergency Medicine program, the residency program, we have 48 residents in our residency training program. Every single one of them is required to fly during their career. It's a part of the training program. We're one of very few programs that actually has a physician on every flight at University Air Care, and every one of our residents does fly. And so they have to know that when they come into the interview process of interviewing for a job here to go through the match. It's an incredible recruiting tool, and then it's an incredible patient care tool when we actually have a physician on every flight, and we fly our second, third, and fourth year residents throughout the duration of their career here at UC through the residency program. But every single resident flies and usually logs somewhere around 100 flights in their career by the time they finish. Obviously that's an average, some less, some more.
A lot of other programs will have flight physician experience available, but not mandatory, but it's definitely an integral part of the residency program here. So in looking for residency, I was looking for one of the best in the country, where I could be trained to be the best emergency physician I could be. The quality of the people here are phenomenal, and they were the people that I wanted to surround myself with as my peers. So that's how I ended up here.
Our residency is a 4-year program. You have your intern year, which our interns don't fly. That we believe that there has to be a core amount of becoming a physician and getting the training and the necessary skills to be out on air care with a nurse. And so our residents get through their first year and then start flying July 1st of their second year. And then our training program is a little bit different than most training programs. The majority of emergency medicine training programs are 3 years. Ours is 4 years, and there are about 10% of the programs in the country are a 4-year program, and we happen to be one of those programs.
It's an eye-opener as far as understanding what pre-hospital medicine is all about. I mean, I accept patients in 2 factors, in that I am an emergency attending down in the emergency department here at UC, and then I also work up in the NSICU as a neurocritical care fellow. And air care brings patients to both places. So I get inter-hospital transfers into the unit upstairs, and then a lot of trauma and inter-hospital transfers or scene transfers into the emergency department downstairs. And I think that having gone through that training experience just makes me appreciate what the conditions are like out in the field, particularly at motor vehicle collisions when they're picking up trauma patients. I mean, it is, in a patient that's acutely injured, it is very hard to get an IV in those patients. It's very hard to put a breathing tube into those patients if they need one. I mean, they work in very in suboptimal conditions out there, and paramedics and EMTs do the best that they can out in that environment, and sometimes they just don't have the tools that they need to take care of the patients, and that's where air care comes in to really complement what those paramedics and EMTs do out there. And I think I have a better understanding just of what they deal with from being out there myself and working with them out in the field.
We have 2 different types on the air side of calls. We have what we call a scene call, and we have an inter-hospital call. An inter-hospital call is between 2 facilities, and we get a call from one facility wanting to fly a patient to another facility. So whatever level of care is not offered at one facility may be offered at the other. So it's always a higher level of care from one to the other. So what they'll do is they'll contact us and ask us if we can fly. If we can fly, then we go ahead and take the information and dispatch the aircraft. The big question is if we can fly. We go on a traffic light system for weather, red being no, yellow being caution, and green being go. With go, we don't have to ask the pilot, hey, is the weather okay to fly? We know it is. If it's yellow, that means caution. Something's not right in the area. Our minimums may not be met. It may be raining, snowing, sleeting, icing, whatever. We're going to double check that. So before we even accept the flight, we'll call the pilot and tell him the destination point A to point B. We do not give a description of the patient or anything. We don't want that to cloud the judgment of the team. On the radio, I'll say Air Care 1 or Air Care 2 pilot weather check. Okay, so once we get that okay, then we can fly. If it's red, we already know we're not going anyplace. So we can turn that flight down right away. And we tell the people why we can't fly. And if it's safe to send our ground unit, then we can say we can offer this by ground. For scene flights, that would be going out to an auto accident, a shooting, a stabbing, out in the field, out in the community. The 911 center is called by the fire department and said, we need an aircraft, or check for an aircraft's availability. The 911 center in turn calls us. Once they call us, we still go through the same weather check to make sure we're okay to fly. If we're okay to fly, we automatically dispatch that team out to the scene. Once we get dispatched, in the comm spec, it is our responsibility to make sure that we get a cross street, an address, someplace where we can look onto the map and get the GPS coordinates. With those GPS coordinates, we relay those to the pilot, and that way they can fly between point A and point B in the shortest direct line as possible. We also make sure we have a radio frequency to contact the ground before we land so we can get a patient update and that LZ safety briefing so we know what's going on. All that's going off all this time, and we only have 6 to 8 minutes to have all this happen. We're getting the information, we're alerting the facility, be it children's, be it university, if it's a trauma center. We're letting them know, hey, we're sending the team out, this is how long it's going to be. That way the emergency department knows, the trauma people know, everybody is on the same page at all times. And as the aircraft is on the way out, it is our responsibility